The poor pay for medical doctors in Nigeria is making them to seek entrepreneurship opportunities in other fields amidst the ongoing nationwide strike. Here's the report.
The ongoing strike by Nigerian doctors due to poor pay, the National Association of Government General Medical and Dental Practitioners is urging medical doctors to combine entrepreneurship with their practice.
It is my hope that this conference will bring memorable and scientifically very profitable to equip us with required entrepreneurship skills to make more money and to live more fulfilling life.
With the recent migration of Nigerian doctors to other countries to seek greener pastures, this gathering is looking at ways to support health practitioners on how to deal with unpaid salaries and delayed benefits. They are being urged to embrace side businesses that can go along with their jobs.
Doctors are being most poorly paid in our country, so it's quite unfortunate. So if they are agitating, we only need to sit down and have give and take kind of understanding. Otherwise, when you begin to compare apple and orange, or you begin to look at borders and limited or unlimited borders, doctor on borders, you begin to ask yourself, is it really worth it? So some have expressed the fact that they are regretting working in Nigeria.
The salary you're getting from government, well, yes, in our climb, people might say it's okay, but globally, if you look at it, it's nothing to write home about. That's why there is brain drain. People are living here to where they are appreciated, and then they are paying. For instance, in UK, what they pay in UK is about 4 times what the government, what they pay here. In Saudi Arabia, it's about 6 times what they pay here. But people are here laboring. Well, we have no other place to go than we are Nigerians.
Some doctors at the meeting frown at the strike action embarked by their colleagues, tagging it as unnecessary as there are other measures that can be employed to tackle the situation.
No matter how the pendulum swings, we should remember that the ordinary citizens, their own brother, sister, father, mother, and what have you. So when we say people are suffering from the healthcare system, either because of the inefficiencies of the practitioners or that of governance, the people that feel the pinch most are the citizens of this country. And we are all citizens of this country.
The meeting hopes to enlighten medical doctors on alternative streams of income that can go alongside their jobs.
Okay, for more on this, we are now being joined by the acting chairman of the National Association of Government General Medical and Dental Practitioners, Dr. Titilope Egbuson, that's of the Federal Capital Territory. That's the chapter you represent. Very warm welcome to Newsnight, and I see that yours is you work for government.
Yes, we do.
And now the times are tough, and you now want to combine government work with enterprise. Would that not, be cheating the government and the rest, because you could use government time to do your business too?
Well, the way to go about it is not to use government time to do your business. And you need to realize that in Nigeria, with the daily depreciation of the naira and the heavy burden people who are working are carrying, we have realized that one stream of income doesn't carry you to the market. So when we say other sources of income, it doesn't necessarily have to be medical practice. It can be any other thing. And we are trying to encourage our colleagues, because in medical school we just taught about medicine. We're not giving taught any business skills. So the idea now is to encourage doctors to look at opportunities around. You don't have to keep on treating patients till you collapse. There are so many other avenues, and we are encouraging doctors to equip themselves with these skills so that they can have other streams of income that can even help them to maybe even give healthcare free to the needy.
Right. Right. I'm really excited about what you're saying, because at the end of the day, we all live in the same society, and we
Yes.
know the state of the Nigerian economy. But I do know that the tax before the Nigerian doctor is enormous. I'm wondering where you find the time to be able to combine practicing medicine and having a business on the side.
Well, the trick is to start early when you are very young, to start building up this business. And then it's also very important for people who are going into retirement, because if you're going into retirement as a doctor, you're going to earn less than what you were earning when you were working. And how do you cope? The needs don't necessarily get reduced in retirement. So we're waking up to the fact that we need to think outside the box. There are still opportunities, as bad as things
So what are
appear.
these opportunities, and what sort of businesses should the Nigerian doctor be considering while still in service to ensure that
Anything.
they're able to get some more money?
You identify a need, you look for a problem and try and solve it. You identify some services people need, and you know, build up your capacity. You may need to train, receive some training, business skills, some mentorship, anything outside medicine. And if you're so passionate about medicine, you can also have your private
What
practice
sort of
by the
business
side.
do you do?
I'm a late starter, so I'm still trying to, look into that area, because I realize that retirement is coming around very soon. And, if you really want the doctor not to have to think about other streams of income, then you have to do something about remuneration and conditions of service that would make someone who's passionate about medicine just face medicine alone. But life is diverse. You don't have to just stick your head in medicine and medicine alone.
So that's just corroborating what the former Minister of Health said, that doctors can go and learn, become fashion designers.
And even become farmers as well.
And farmers, hairstylists, and the rest,
Well, it's possible, but I'm sure that we want a very, well articulated and committed set of doctors to look after, or even healthcare workers generally, to look after our population.
Have we seen that commitment with the strike embarked upon by your junior colleagues, the National Association of Resident Doctors?
Well, the strike they have embarked upon, is necessary.
At this time of pandemic, where in the world have you heard of doctors going on strike? Even the poorest of the poorest countries.
Where
in this pandemic?
Let's talk about the pandemic.
Yeah.
Where in the world do you have healthcare workers paid 5,000 naira hazard allowance in the middle of this pandemic and actually risking your life? Because when you are sitting there as a frontline worker, you don't know what's coming at you. And an angry healthcare worker or doctor is not a good one. You are struggling to pay your rent, your car is beat up, you have school fees and all that, and then you get to work, and in the middle of the pandemic, you are not even sure that you'll be well protected, or that if you succumb to any of these infections, that, somebody has your back.
You're saying the strike is necessary, and aside from the resident doctors, I know that GOVT has given its own notice. NMA has actually given its own ultimatum to the government as well. But in all of this, the Nigerians are the ones who are suffering, especially the poor ones who cannot afford to go to a private hospital. So how do we get out of this impasse to avoid the brain drain for one, and also this incessant strikes that we're seeing almost every single year?
Strike is the last resort of any healthcare worker or doctor. They don't want to go on strike, but the issue is that to get the attention or the answers that they need, the solutions, it seems it's only when people say they're on strike that people sit up. And then, yes, we know that people are suffering, but the doctors themselves are suffering. And the brain drain, if the conditions of service or the infrastructure and the conditions under working conditions are improved, then the brain drain will not occur. There's so many things that are lacking, you know. It takes so much to train a resident to become a consultant. People have to pay for their training fees, all the courses they do to build themselves up. The government that they work for is supposed to at least subsidize part of it. But, you know, what we've been seeing subsequently is that there's less and less of that. And I guess it's because of the general, you know, economic crunch. But, you know, when you see your human resources, they are very important and they can actually increase the wealth of the nation. But if you don't manage them properly, then they're going to move off to greener pastures. The only ones that are not moving out are those of us who are close to retirement. We have strong family ties here. All the young ones are leaving. And you realize that I myself will have to depend on a younger doctor to look after me. So we are not resident doctors, but we are sympathetic to their cause because our children could be resident doctors tomorrow.
Right. We have to find a solution, really. Acting Chairman of the National Association of Government General Medical and Dental Practitioners, Abuja chapter, that's Dr. Titilope Egbuson. Thank you so much for being here tonight.
Thank you very much for having me.